Hello everyone, hello again. This is a workshop, Dr. Dmytro here, and I'm going to talk about mito-organelles in biological medicine and therapeutic rejuvenation, the best, the better, and the rest. And this is the mito-organelles, one of its range, SPMC 5-in-1. That's how it looks like. You can see it on your screen, mito-organelles, researched, developed, and formulated by Stella Biomolecular Innovations in Germany, and offered, delivered, and provided to you by the MF Plus brand. So first of all, let's look a little bit on a history of organ-specific peptide therapy with organ-specific cell extracts. For instance, 1993 Journal of Applied Nutrition, the effect of cell extracts from liver, lung, and thyroid, a 59% decrease of transaminase levels in treated patients. Patients with low thyroid hormones had a 76% increase in T4 levels, and patients with COPD after administration of the lung cell extracts, 43% of them had improvement in respiratory function. Lean used the thymus extracts. They stimulated production, maturation, activation of T cells, restoration cellular immunity in secondary immunodeficiency patients, published in Immunopharmacology in 1989. Wilson, anti-aging effects of the liquid thymus extracts. Cazzola, thymic extracts in treatment of atopic dermatitis, chronic bronchitis, viral infection, and recurrent respiratory and rheumatoid arthritis. They've demonstrated that use of the thymic cell extracts normalizes the CD4-CD8 ratio. Genova, thymus cell extracts in treatment of children with food allergies and respiratory disorders. Peterson, Yokohama, and Fujisawa, they use liver extracts, and they found them to improve liver regeneration and fatty acid metabolism and carbohydrate metabolism in patients with metabolic syndrome and liver injury. Hypothalamic peptides, they regulated production of wide range of hormones. Pancreatic peptides enhance production of pancreatic enzymes. Chromogranin A, one of the mitochondrial peptides contained in abundance in xenogeneic adrenal extract, demonstrates anti-stress properties, enhances steroid hormone synthesis in adrenal glands. Spleen extracts enhance immune system, stimulate macrophages, even in the AIDS patients. The use of the cartilage cell extracts by the Pruden, who is been known as the father of the cartilage therapy, showed the promotion of the remission of the osteoarthritis in 59% of patients, and 75% of patients were pain-free, as per article published in 1982. Duodenal cell extracts, peptides, they modulate the release of somatostatin, epidermal growth factor, secretin, gastrin, and growth hormone releasing factor in patients with metabolic syndrome. So mito-organelles, they predominantly target and enhance mitochondrial function. What is the mitochondrial function apart from the synthesis of the ATP? And we know that the mitochondria is the power plant of the cell. So it's a storage of the calcium ions, signaling and communication between cells, regulation of the apoptosis, regulation of the intracellular carbohydrate and lipid metabolism, synthesis of the steroid hormones. It's happening in such anatomical locations as mostly adrenal glands or the gonads, but where exactly in the cells? Inside the mitochondria of those cells. Hem synthesis for hemoglobin and regulation of cellular proliferation and other cellular functions. The characterization of the peptides released from mitochondria has about 20 years history. One of the first articles was in the year 2004 from Köln, titled Characterization of Peptides Released from Mitochondria, and you can see it on your screen. So those days, 20 years ago, they've identified only 270 different peptides. They provided their characterization and localization. They've identified that about 40% on the inner membrane of the mitochondria, 60% belong to the matrix space, and predominantly these peptides are involved in regulation of the functions of the respiratory chain. Later on, 20 years after that, you can see the article titled Novel Progression from Cell-Based Therapies to Increasingly Refined Cell-Free Approaches. It's a collaboration of European Wellness Biomedical Group together with the University of California, Irvine, and the University of Bohomolets, National Medical University of Ukraine, where we have discussed the characterization and the clinical application for the subcellular products, medicinal products known as the Mito-Organelles. We have shown in this article that these peptides are designed to mimic the activity of specific growth factors, promoting cell proliferation and differentiation. The mito-organelle peptides are biologically extracted mixtures of cellular peptides that predominantly represent and enhance the mitochondrial specific function. During aging, the volume and strength of the signal of the mitochondria declines, causing the signals to be sent back to the nucleus to arrest cell proliferation and initiate apoptosis and cellular death. So the mito-organelles peptides as organ-specific extracts, they aim to revitalize and rejuvenate mitochondrial function, thereby regenerate cell and the entire organism. Together with University of Heidelberg, we have provided further characterization of the organ-specific peptides and protein ultrafiltrates, and have shown their role as therapeutics. We have analyzed the content of of multiple types of organ-specific peptides. We have shown that there is a certain overlap of the peptides, proteins, and growth factors that are universally present in all types of the tissues. However, there's also a large portion, about 60 to 70% of the peptides, that are quite unique to different type of tissues. So examining this protein makeup enables the identification of therapeutic targets and signaling molecules crucial in biological processes and disease treatment. And because specific proteins and peptides and protein fragments in ultrafiltrates, they provide the insights into underlying molecular mechanisms which are associated with the physiological and the pathophysiological states in every particular case. And during the further analysis, which was done in the University of California, Irvine, we have tested 2 batches of 6 different types of organ-specific peptides. We have shown the high consistency in concentration and fractions of peptides in every batch. And we have identified and established that the short peptides play a crucial role in modulating the transmission and transcription of biological information that have been shown to decline throughout the natural process of aging. So peptide therapy aims to either reinstate normal signaling patterns by renewing the strength of the signals received by the cells, or induce the cells to begin to produce peptides of their own. And since different tissue types produce different peptides, peptide therapy utilizes organ-specific extracts to target aging and diseased tissues with the goal of restoring the normal signaling and improving overall health and well-being. We have also tested possible the potential toxicity and carcinogenic potential of the mito-organelles. It has been done through the cell transformation analysis, and the cytotoxicity study of the tested extracts on cell viability and metabolic activity indicates that the selected range of medicinal biological products known as the mito-organelles, specifically extracts from the heart, from the brain, kidney, cartilage, thymus, placenta, lungs, connective tissue, and such combinations as LPP-SAMKE, for instance, they have shown zero cytotoxic effects on the humans, and assessment of the carcinogenic potential of these mito-organelle cell extracts did not reveal any signs of malignant transformation or malignant morphological changes in treated cell lines at all. Thus, we have confirmed that there is zero risk of cancer development. Yeah, so we have assessed the cytotoxicity of the mito-organelles, none, zero. Evaluated carcinogenic potential, there is no such carcinogenic potential at all. We have compared the toxicity across different types of the mito-organelles, and none of them have demonstrated the cytotoxicity or carcinogenic potential, and we have come up with the safety and efficacy recommendations for the clinical use. So where are these mito-organelles used in? Well, one of the most famous mitochondrial peptides, humanin, is known to have a very strong neuroprotective factor, for instance, antagonizing Alzheimer's disease. Small humanin-like peptides, 6 fractions of them, are involved in age-related disease progression, insulin synthesis, and its deficiency or the decline in its production, endogenous synthesis, is usually resulted in metabolic dysfunction and increase of the pro-inflammatory function. And also, the drop in the production of SA of the mitochondrial peptides also provides the increased level of the leptin, and treatment with the mito-organelles improving the insulin sensitivity in the patients. Another mitochondrial peptide, cardiolipin, for instance, is heavily involved in a cholesterol translocation from the outer to the inner membrane of the mitochondria. It activates mitochondrial cholesterol side chain cleavage, and as we know, the cholesterol is the first molecule in the entire cascade of the synthesis of the steroid hormones, including the cortisol, pregnenolone, progesterone, and testosterone, and estrogen further. The cardiolipin is involved in importing the proteins into the mitochondrial matrix. It acts as the anticoagulant, and it also modulates the alpha-synuclein, which the malfunction or malfunctioning of the alpha-synuclein gene is very much linked to the onset and development of the Parkinson's disease. So indirectly, we can say that the mitochondrial peptides and the mito-organelles can be used in the management of Alzheimer's disease, prevention and treatment of Alzheimer's disease, and also reduction of the risk of development, onset and development of the Parkinson. On this slide, you can see the main steps of how the mito-organelles are made. They're prepared from the mitochondria, centrifuged, resuspended, homogenized, and put in the vial. We do not use any heating. It is strictly a cold enzymatic process using the proteolytic enzyme extraction technology with a further peptide fraction isolation, centrifugation, and filtration. And filtration goes through multiple stages to achieve the ultrafiltration technology. To select peptides and polypeptides of a specific molecular weight and size. It is a EU certified technological process manufactured in the EU. It does not have any stabilizers, conservative preservatives, or any chemicals. It's a strictly biological product, and it is a DNA and chemical free. Here you go once again, Mito-Organelles. That's how the box look like. And here is the spectrometry chromatography, the comparison between the nanopeptides and the mito-organelle peptides. You can see that apart from the below 10 kilodalton, that from 3 to 7 kilodalton molecular weight, there's also another fraction of about 45 to 65 kilodalton significantly present in all types of the mito-organelles. Some of the active ingredients, we have identified the protein, number of the sequencing, the amino acid sequencing, the genome, where it is localized, and what sort of function, whether it's involved in a carbohydrate, metabolism, or protein viability, protein synthesis, or the protein degradation. You can see the Mito-Organelles product range. Generally, it consists of the aesthetic and therapeutic. And therapeutic is anti-aging, like a holistic anti-aging, and also specific medicinal peptides which target specific systems or organs, parenchymal organs, and also immune system, such as the transfer factors or the thymic peptides. European Wellness Biomedical Group has united to various scientific, educational research institutions to conduct an independent clinical research, laboratory and clinical research of the mito-organelles, such as Heidelberg University in Germany and University of California, Irvine in the United States of America. We have done MALDI-TOF mass spectrometry. It has been published. You can see a type of the MO peptides that have been studied. It's MO liver, lung, CNS, cartilage, LPP-MKE for the metabolic syndrome, placental, thymus, heart, kidney, and MO mesenchyme. All batches and all types of the peptides have demonstrated stability and equal presence and concentration of peptides in each batch and each vial. You can see further comparison between the nano-organopeptides and mito-organelles, whether it's the MO placenta, MO LPP-MKE, MO thymus, MO lungs, with the corresponding types of the non-organopeptides. And you can see that concentration and osmolarity and molecular weight of the peptides is, of course, tens of times higher in the mito-organelles compared to nanopeptides. Study done in Heidelberg University has shown no toxicity to human cells, no toxicity to human embryonic cells. Mito-organelle peptides have demonstrated high specificity to antioxidative pathways. They contain stable proteins that did not denaturate in long-term storage and have shown zero DNA contamination or presence in its content. A further gene ontology bioinformatical analysis in Heidelberg University, Germany, has shown high affinity to molecular function, cellular components, and biological processes in all types of the mito-organelles, plus high level of organ specificity in every type of the peptides. If we look at the biological pathways that these peptides are involved in modulation of, we see that they're very much involved, they have a high affinity to the oxidative stress enzymatic pathways and cellular communication and apoptosis signaling pathways in the cells. And also the gene ontology analysis shows a high affinity to practically all cellular functions. And if we put it in a chart, we can see that mito-organelles are involved in practically entire biochemical terrain and all biochemical pathways of the human organism, including the fatty acid degradation, degradation of amino acids, pentose phosphate pathway, gluconeogenesis, fat digestion, absorption, fatty acid elongation, citrate, TCA cycle, drug metabolism, and even the glutathione and ubiquinone pathways. And mito-organelles and overall mitochondrial peptides have been identified as a novel regulators of metabolism because they modulate retrograde signaling. They modulate and regulate mitochondrial bioenergetics and mitochondrial metabolism. They modulate and enhance systemic insulin sensitivity and insulin homeostasis. They promote and increase and enhance insulin uptake and glucose uptake and glycolysis in the muscle tissue. And as we know, the muscle tissue are one of the, perhaps the main metabolically active organ. They promote AMPK activation. They activate proteases and proteolytic enzymes. They regulate cellular stress response mechanisms, and they increase levels of the NAD and increase ATP production. Hence, the main functions of the mito-organelles that we look into in a clinical setting is or are reversal of the mitochondrial dysfunction, prevention of the mitochondrial depolarization, inhibition of neuronal apoptosis, inhibition of pro-inflammatory markers, protective effects against cardiac ischemia perfusion injury, potent antioxidant and neuroprotective effects, and selectively binds to cardiolipin and modulates its interaction with cytochromes. Hence, the clinical benefits of mito-organelles are mostly neurodegenerative conditions such as Parkinson, ALS, Alzheimer's disease, age-related macular degeneration, diabetic retinopathy, glaucoma, and even potentially in retinitis pigmentosa, diabetes type 2 and metabolic syndrome, reduces pro-inflammatory markers in chronic degenerative disorders such as osteoarthritis, for instance, and normalizes hormonal biosynthesis in the hypothalamus and adrenals, both the glucocorticoids and mineralocorticoids and the gonads, and also the calciferol production in kidneys. So it's a massive endocrine benefits as well. What are the evidence-based effects of mitochondrial peptides? Well, we know that the mitochondrial-derived peptides play a pivotal role in intracellular signaling throughout the body that regulates both metabolism and cellular survival. Mitochondrial dysfunction in its turn causes metabolic disease and neurodegenerative disease. Hence, mitochondrial peptides have the ability to prevent, slow down, even reverse metabolic disease and neurodegeneration to a certain extent. That's why it is used in memory loss, effective in Alzheimer's disease, atherosclerosis, and diabetes. It reduces age-related myocardial hypertrophy, improves cardiac functioning, and promotes metabolism of cholesterol and its conversion to pregnenolone and further the entire cascade of the steroid hormone synthesis. We have done a study a few years ago that in which we tried to establish the role of the mito-organelles in concentration of the reactive oxygen species, and also in therapeutic rejuvenation and revitalization. We took individuals older than 60 years old in the 7th and 8th decade of life. The main including criteria were at least 2 or more of chronic age-related conditions such as diabetes, ischemic heart disease, hypertension, osteoarthritis, cataract, dementia, neurodegeneration, and so on and so forth. Of course, none of those patients were in acute state. Those were chronically ill aging patients. And we have studied the serum humanin level, small humanin-like peptides, superoxide dismutase 2, catalase, and reduced and total serum glutathione assay. A treatment protocol was involving mito-organelle peptide male and female revitalization. It's a combination of 12 organ-specific peptides in one, administered intramuscular twice per week for a duration of 8 weeks. On this slide, you can see the day 0, the levels of the humanin and the small humanin-like peptides before the treatment on day 0, and also the superoxide dismutase 2 catalase and glutathione assay. And here are the results of the study. After 8 weeks of treatment, we see a near complete normalization of the humanin levels, almost complete normalization of small humanin-like peptides, increase in a reduced glutathione assay. It did not come back to a completely normal range, but there was a statistically significant increase, and near complete normalization of a superoxide dismutase 2 and catalase assay, which are the main parameters of the mitochondrial parameters of the antioxidative stress. Clinical improvements were observed in 97% of patients. The reduction of the HbA1c was at the rate of about 15 to 20% additional. Same concerned the blood lipid profile. Reduction of the visceral and subcutaneous body fat, plus the reduction of the body weight from 2 to 8% in all observed patients. And we use the body composition test for that. And none of the patients developed any side effects or allergic reactions. The clinical outcomes, most of the patients noted the improvement in general condition, cognitive function, and their performance status. And the mito-organelles peptides demonstrated a synergetic effect with the regular medications that patients were taking, and even a reduction of dose or frequency of intake of some of the medications. Even some medications became obsolete. And as I said, no adverse, neither allergic reactions were observed throughout the treatment in any of the patients. That allowed us to make a summary that mito-organelle range of peptides are indeed an effective method of therapeutic rejuvenation and revitalization. It improves at least 3 major mitochondrial functions, such as the apoptosis, metabolism, and oxidative stress, and are safe and promising therapeutic solution for internal, holistic, and also aesthetic medicine. That study was published. It was presented in Barcelona in a World Congress of Anti-Aging and Aesthetics, and it was published in Aesthetics and Dermatology in Surgery in 2016. We also tested another formulation, LPP-SAMe-KE, which consists of cell extracts from liver, placenta, pancreas, stomach, intestinal mucosa, kidney, retina, and is used in individuals with metabolic syndrome. Usual administration protocol is 2 to 3 vials per week, intramuscular, with a minimal duration from 10 to 16 weeks. I would have said 15 to 16 weeks of treatment would have been the optimal duration. This formulation is known to activate autophagy, stimulate mitochondrial biogenesis, promotes gene transcription, mitochondria, thus upregulates all the mitochondrial peptides in its function, activates anti-oxidative defense system, regulates fatty acid oxidation, and increases glucose uptake in tissues, brain tissue, and also the muscle tissue. So direct anti-diabetic and anti-Alzheimer's effect. Interestingly, that we have also tested the Mito-Organelle pancreas on its ability to prevent and reverse diabetes type 1 and specifically autoimmune diabetes in an animal model of the autoimmune diabetes. And that experiment was conducted in USA, in the University of California, Irvine, involved diabetes-induced mice. There were two groups of them. The main group was treated with mito-organelle peptides in a dose of 7 microgram per milligram. It's human dose that was scaled down to the body weight of the mouse and administered subcutaneously twice a week for a duration of 17 weeks. And the control group used their normal saline. There were blood glucose measurements done weekly throughout this experiment, and also the cytokine panel to check the level of the cytokines in both groups. Comparison between the mito-organelle treated and the normal saline treated groups. So as outcomes, we have seen that in the mito-organelle treated group, there was a 90% increase in the EPO, erythropoietin factor, which is a crucial cytokine during the embryonic and early development of the pancreatic tissue, and especially the islets of the pancreas, and its ability to produce insulin. And also EPO is involved, it exerts massive anti-apoptotic, proliferative, anti-inflammatory, and angiogenic effects on the islets of pancreas. And we have seen a 90% higher assay in the MO-treated group. In the same time, started from the second week of the experiment, throughout entire 17 weeks towards the end of the experiment, the MO-treated group had a statistically significantly lower glycemic level, mean glycemic level in all animals, starting from the second week of the treatment. That resulted in the end of the entire experiment, the population of the non-diabetic mice in the mito-organelle peptides treated group was 33% less than in the saline treated control group. So 33% greater non-diabetic population compared to the control group. Hormonal optimization with mito-organelles. Well, we talk about it on many occasions, and in one of the previous lectures on the first day about the osteoporosis, I talked about the enhanced hypothalamo-pituitary-gonadal adrenal axis protocol, stimulation protocol with HCG and hormonal precursors and selective receptor modulators, macro and micronutrients. Further addition of the mito-organelles 5-in-1, which are the cell extracts from the adrenal cortex, liver, hypothalamus, pituitary, and testicular peptides. Together with HCG 5000 IU in 3 split doses per week. If indicated, Clomid, about 25 milligram daily, with zinc as a micronutrient, omega-3, magnesium 400, proviron optional if it's necessary, hormonal precursors such as the pregnenolone, DHEA, creatine supplementation, growth hormone, carbogalin and kispeptine peptides plus the 2 to 3 vials per week of the Mito-Organelles, duration of 3 to 4 months. It's about 120 days to 180 days maximum. Have brought us to a 100% efficacy rate compared to the 70% efficacy rate with the standard approach, and a significantly higher increase in a testosterone yield, more than 200 nanogram per deciliter, more than 7 nanomole per liter compared to the standardly treated group, with of course longer duration, up to 1 year plateau of the total testosterone level compared to only 2 to 3 months plateau of the testosterone compared to the in the standard treated group. This study has been published in a Journal of Obstetrics and Gynecology International Journal, and also it has been translated to Spanish language and other languages and included in publications and treatment. So on this slide you can see the outcomes, the total testosterone level increase. You can see the entire cohort of men in this group was hypogonadal on the day 0, and by the end of the treatment protocol, day 120, all of the patients, 100%, have improved the endogenous production of the testosterone. You can see day 210 and 1 year follow-up. There is a slight trend towards the reduction, but it's really not significant, so we can see that the plateau in a total testosterone level is there for at least a year. We have used a similar approach in females also in treatment of menopausal, postmenopausal women. We have enhanced the standard protocol with kispeptine and bromelanotide, plus the alpha-melanocyte stimulating peptide, which is present in enhanced PEP as an oral formulation, plus the Mito-Organelles female fertility 5-in-1. It's adrenal cortex, pituitary, placenta, liver, and ovary cell extracts, 2 to 3 per week for 4 months, plus the clitoral ureterovaginal injections, or we call it the advanced CUV injections with the nano-organopeptides of placenta of the triple formulation, which is done monthly, plus the either radiofrequency, Emcella, Termiva, and so on. And you can see the outcomes in the female group is increase of estradiol level in all patients. Again, we had 100% response with reduction of the FSH absolute levels and the mean level of the FSH you can see on the right slide on your screen. Peptides in cardiology, Mito-Organelles in cardiology. We have done some work, some analysis, and we have published that in Advances in Clinical and Medical Research. The article is titled Peptides in Cardiology, Preventing Cardiac Aging and Reversing Heart Age. So we have shown the Mito-Organelles HAT, the extracts from the cardiomyocytes. They modulate the inflammation, chronic inflammation, one of the main hallmarks of the cardiac aging. It reduces inflammation in the heart muscle, provides regeneration and repair of the damaged myocardial tissue by promoting cell proliferation, survival, and angiogenesis. Massive antioxidative effect, vasodilatation. It increases the blood supply and oxygenation and promotes angiogenesis, formation and opening of the collaterals, and the formation of the collateral blood supply to the myocardium, and plus the regulation of the cellular signal and reduction of the apoptosis in the cardiac myocyte. The indications for the Mito-Organelles HAT are the cardiomyopathy, ischemic heart disease, congenital heart disease as a preparation for or after the heart surgery, even after the open heart surgery. As a protocol, it's usually from 2 to 5 vials per week, duration at least minimum 12 to 15 weeks Ideally to combine with the coenzyme Q10, co-carboxylase, meldonium, hexarelin, GHRP6, stem cell treatment, hyperbaric oxygenation, and ECP. And as outcomes, we expect to see at least 10 to 15% increase in the ejection fraction, and also reduction of further symptoms, other symptoms of cardiomyopathy, such as the chest discomfort, pedal edema, cyanosis, and shortness of breath. So the Mito-Organelles have shown a significant potential in cardiac regeneration. And the mechanisms through which Mito-Organelles exert therapeutic potential in cardiology lies in their ability to modulate mitochondrial function and promote cellular repair mechanisms, specifically in response to cardiovascular stress, such as ischemia. So as a response to the myocardial ischemia, it can sort of prevent and reduce the area of the myocardial infarct and promote faster recovery and regeneration of the affected tissues. MOCNS, or the neuropeptides, brain peptides. Main indications are the neurodegenerative conditions such as the Alzheimer's, Parkinson, Huntington disease, and also neurodevelopmental conditions, and also post-stroke, mostly the ischemic stroke. The protocols of clinical administration or clinical use of MOCNS are such. For neurodegenerative disorders, it's usually a 30-week protocol with 2 to 3 vials per week. A pediatric protocol in neurodevelopmental conditions is usually 10 weeks, twice a year, about 1 to 2 vials per week. And post-stroke, the therapy started usually as early as possible, and they can be done daily for about 4 weeks straight. As a part of the integrative therapy approach for neurodegenerative and neurodevelopmental and stroke, MOCNS are combined with the neurotransmitters, with the choline donors for acetylcholine, plugs therapy, cerebrolizing, microextracts that have a massive neuroplasticity effects, theta chamber, hyperbaric oxygenative therapy, transcranial electromagnetic stimulation, and stem cell therapy. Liver failure. How can we use Mito-Organelles, mitochondrial peptides, specifically cell extracts from the hepatocytes? You can see it on your screen. We have successfully implemented that even in cases of the liver failure when the person was put on the liver transplant. For instance, one such case of the toxic hepatitis and liver failure presented with jaundice, all the deranged liver function test, and coagulation confirmed on the liver scans and biopsy, Child-Pile score 8 to 9, and the model of the end-stage liver disease between 23 to 25. And this patient was included on the transplant list for the liver transplant. However, we have initiated the treatment protocol with the stem cells, with the detox, hepatoprotection, hyperbaric oxygenation, plasma exchange, antioxidants, precursor stem cell transplantation, and Mito-Organelles of the liver. And we have achieved a near complete reversal of the liver failure, and the patient was removed from the liver transplant list and eventually discharged from the follow-up of the liver surgeon because the liver function test has completely normalized. CKD, the chronic kidney disease, another case presentation of the CKD end-stage renal failure, CKD5, a patient that was treated with multiple sessions of the precursor stem cell transplantation using the massive doses of the renal precursor cells. As I said, there were multiple transplantations done over the years, and in between the stem cell transplantation, there were a series of protocols of Mito-Organelles, kidney and heart, because this patient also has, apart from the end-stage kidney failure, end-stage renal failure, he has the underlying cardiomyopathy and a survival from the myocardial infarction. So we added Mito-Organelles heart also, together with NO donors, L-carnitine, NIC, placental growth factors, hyperbaric oxygenation, IV ozone, IV laser therapy. Eventually, the patient, initially the patient was on a regular hemodialysis for 8 to 9 months, but we have managed to improve GFR and downstage end-stage renal failure from stage 5 to stage 3A, 3B, with the very latest GFR being 45 and initial GFR being 9. The patient is hemodialysis free. Placental growth factors. Mito-Organelles placenta. We have discussed the insights of its biological and therapeutic properties in the article, Placental Therapies. You can see it on your screen. So in this article, we have explained the contents of the Mito-Organelles. It's heavily loaded with enzymes, nucleic acids, amino acids, peptides, vitamin trace elements, and growth factors. It's over 100 of different growth factors procured from these placental cells. And they provide tissue repair and regeneration, both systemically and locally, whether it's systemic administration or the local administration for the treatment of the musculoskeletal pathologies, or for instance for aesthetics. And active ingredients or the active molecules in the Mito-Organelles placenta, as well as in the fresh and pure HP, such as the polypeptides and amino acids of the collagen, elastin, laminil, proteoglycans, adhesion proteins, insulin-like growth factor, epidermal growth factor, platelet-derived growth factor, fibroblast growth factor 2, vascular endothelial growth factor, and transforming growth factor beta. So, yeah, with this, ladies and gentlemen, I would like to conclude this workshop on the Mito-Organelles, and thank you very much for your attention. And please remember that neither you nor your patients have to get old and deteriorate as you age, as long as you are using mitochondrial peptides. Thank you very much for your attention.